I thought becoming a registered nurse would make me feel confident overnight. It didn't. After nearly a year in the job, these are the things I wish someone had told me when I was a nursing student. When I was a student nurse, I honestly believed that once I qualified, something would just click. I thought I would put on my uniform, walk into the ward, and suddenly know exactly what I was doing. But when I started working as a registered nurse, I quickly realized that qualification isn't the finish line. It's actually the beginning of the whole new learning journey. So if you're a nursing student or you're about to qualify, I hope some of these lessons will make your transition a little easier than mine. The first thing I wish I'd known is that you don't have to know everything. As a student, I put so much pressure on myself, trying to remember every condition, every medication, and every procedure. But I felt like everyone else knew more than I did. The truth is, even experienced nurses are still learning. Healthcare changes constantly, and every patient teaches you something new. One of the biggest shifts in my mindset was realizing that asking questions doesn't make you look incompetent. It makes you a safe nurse. There are so many times during my first few months I had to ask for help. At first I worried people would think I wasn't good enough. Instead, I found that most experienced nurses respected the fact that I wanted to do things safely. So never let pride stop you from asking questions. The second thing is that confidence comes from experience, not from graduation. I wish someone had told me this earlier because I spent my first few weeks wondering why I still felt nervous. The reality is that confidence isn't something you're handed when you receive your registration. It grows one shift at a time, one patient at a time, one challenge at a time. There will be days when you leave work feeling like you made a difference, and there will be days when you go home replaying everything in your head. Both are completely normal. Give yourself permission to be a beginner. And the third lesson is that communication is one of the greatest clinical skills. As students, we often focus on practical skills, taking observations, administering medications, doing wound care, documentation. These are all incredible skills. They're all very important. But what surprised me most was how much nursing is simply talking to people. Listening to someone who is frightened, explaining what's happening in a way they understand, supporting worried relatives, working together with doctors, healthcare assistants, therapists, pharmacists, and the rest of the multidisciplinary team. Good communication makes almost everything easier. The fourth thing I learned is to make the most of every placement. I know not every placement is exciting. Some won't be the specialty you want. Some days you spend hours doing documentation or helping patients with personal care. But every placement teaches you something. Watch how experienced nurses prioritize workload. Notice how they speak to patients. Observe how they manage difficult situations. Sometimes the most valuable lessons aren't the clinical skills. They are the habits and the attitude you develop. The fifth lesson is that time management takes time. This was something I really struggled with. As a student, I couldn't understand how nurses seem to manage so many patients while still answering procedures, speaking with families, documenting everything, handling unexpected emergencies, administering medications. And now I realize that nobody starts out that organized. You learn to prioritize, you learn to wait, you learn to adapt. When your perfectly planned shift suddenly changes, which it often does. Don't compare your beginning to someone else's 10 years experience. The last thing to say is nursing is rewarding, but it's also physically and emotionally draining. There will be shifts that leave you exhausted. There will be patients you'll never forget. There will be moments that stay with you long after you've gone home. Don't neglect yourself. Rest when you can. Eat properly. Stay hydrated. Talk to people you trust. Looking after yourself isn't selfish. It's essential if you want to look after people well. And finally, this is probably the biggest lesson I've learned over the past years. Stop trying to be the perfect nurse. There is no perfectness. The best nurse I've worked with aren't the ones who pretend to know everything. They're the ones who are kind, they're curious, they're humble enough to ask questions, they're willing to keep learning every single day. They're the kind of nurses that's the kind of nurse I hope to become. And if you're a nursing student watching this right now, I hope you know that it's okay to feel nervous. It's okay to make mistakes, and as long as you learn from it. It's okay not to know all the answers. One day you will look back and realize how much you've grown. If you're a nursing student, I'd love to hear from you. What's the biggest thing you've learned, or what's your biggest worry? Leave your comments below. I will do my best to answer your questions or make future videos about the topic you want to hear about. And if you're probably a newly qualified nurse, what's one piece of advice you wish someone had given you before you started? Thank you so much for watching. And if you found this video helpful, don't forget to like, subscribe, and I'll see you in my next video.